Thanks, Mary. All right, thank you everybody for joining us today. I'm really looking forward to this conversation, and definitely I strongly encourage using the chat, asking questions, and lots of discussion, because really our goal is to make this useful to each of you. And I know that's why you're here today. You didn't come here to not get something out of this. So it would be great if you could start with dropping in the chat your name, pronouns, and your organization. So if we could all just take a moment to drop that in the chat so that we can all kind of know who's in the room together, it would be great to get to know you that way. And while we're seeing who's here with us, I also want to thank Sherlina, who's supporting on logistics today. So thank you, Sherlina, my coworker from CSH. So if you also are having any kind of like technical difficulties or a question, you can also message Sherlina during the presentation if you need anything. And thank you again to everybody who's dropping your name, pronouns, and organization in the chat. So it's great to know who's here with us today. So just as an introduction, for disclosures, I have no financial relationships, and there's no products, there's nothing that we're offering in particular related to this presentation today. We're really focused on the information available, and there's no financial relationships with myself or CSH in any of the resources we're going to be talking about today. So again, I think Mary mentioned this earlier, but really wanted to highlight that there were a wealth of organizations and a wealth of expertise and knowledge that went into this presentation today. So all of the organizations listed on your screen contributed resources, knowledge, expertise to really bring this information together, which was also part of a larger series that the Illinois chapter of the American Academy of Pediatrics put together and worked on to really increase education and information available to the community related to the healthcare needs of children. So our learning objectives for today are to really increase our understanding of pediatric practice so that you're able to share that information on options, how to access care, and really provide you the resources so that you can support families in getting access to pediatric care. So today we're really going to focus on, these 6 kind of core components. We're going to talk about what pediatrics means and the types of care available. We're going to spend a little time specifically focusing on resources for children with disabilities. We're going to talk through how to support families in getting care and navigating resources, in particular Medicaid, Medicaid managed care, and then understanding what care coordination is. So to start with, I would love to hear from everyone. If you could drop it in the chat, is there anything in particular that you're hoping to get out of today or that you want to make sure that you learn and hear about today? I would love to see that if you could drop that in the chat. Just a little bit about why you decided to join the webinar today and what you want to get out of our session together. Oh, great, Sophia. So you're potentially exploring a master's in public health. I'm team public health all the way. I have a master's in public health, so thank you for sharing that. And absolutely, access to care and public health are vital parts of our community providers and care teams. Great, so Shannon, absolutely. My goal is 100% that you will definitely understand pediatric care systems better. And definitely encourage all kinds of questions during the discussion. If there's something that we don't touch on, definitely let us know and ask questions. So while folks might be dropping in the chat, we also wanted to provide a pre-test, and there will actually be kind of a post-test. Again, this is just really for understanding the impact of this session. So Sherlina is going to launch a poll for us. So if everybody could take a few moments to complete this poll. We're not going to go over the answers now. We will at the end of the session. But if you could, again, just take a couple minutes and complete this poll. This is a part of our pretest for this session. And that's also a critical part of just, again, understanding impact. Great, and thank you to everybody else who's also been sharing more in the chat about what you're hoping to get out of the session today. And again, thank you everybody for completing the poll. We're seeing the answers roll in, so that's really, really helpful. We appreciate it. And thank you, Lisa and Lee, for your examples of just, again, wanting to be more knowledgeable about case management and supporting folks in having information and resources. So we'll give the poll a little bit more time. It looks like we have almost 80% of everyone who's completed the poll. So we'll leave it open for just a little bit longer because we would love to hear from each one of you in this poll or the pretest. Again, it looks like we have mostly case managers on the line, so that's fantastic. And really a wide range of experiences that folks are bringing to the table as far as how long you've been working, in the field. So I really appreciate everybody taking the time to complete this. And we'll go through, at the end, we'll go through kind of what the answers are. All right, so I think we'll go ahead and close it in maybe like 30 seconds. We'll do our final call. So if you're mulling over any questions, it's totally okay to pick one. There's no penalties, and we don't, we're not tracking for who's picking what. This really is to just help us gauge the impact of today's session, to really get a sense of where folks are at right now, and then we'll get a sense of where everybody's at the end of our session today. All right. So I'm going to go ahead and end our poll. All right, thank you everyone, that was fantastic. So moving ahead with our session, let me just, sorry about that, a slight tech glitch for a minute there. So again, just wanted to revisit really the basics of what we're going to go over in this section. Pediatrics is specifically for children up to age 18. Some pediatricians do go up to 21. And I've also, definitely heard from pediatricians that for really medically complex children and youth, that they will occasionally keep seeing, youth a little bit longer. So giving youth more time, especially for those medically complex youth, more time to transition into that adult care and adult systems of care. One thing to really highlight is that in particular for children with disabilities, seeing a pediatrician has that added value because pediatricians bring that expertise. They really specialize in children's care, and they have additional expertise and training to really be positioned to evaluate developmental milestones. And they also have a really great understanding of resources and interventions and supports that might be needed and available to support children, in those developmental milestones. So when we're thinking about pediatricians, you can find pediatricians in really three different primary places. So one, federally qualified health centers and community mental health centers. Um, then there's also like the large health systems and academic medical centers. And then there's also the pediatric private practice. We're going to talk a little bit about the strengths kind of each one of these areas or each one of these places to get care so that you're better equipped to kind of describe and understand, you know, each one of these systems to support families in picking what's right for them. Because, there's really no one size fits all. There's no one best practice for everyone. It's really about what's right for that family, what's right for that child's specific needs. So when we're thinking about private practice, again, care is specifically for children from infancy through adolescence. In a private practice, there may not be a social worker, an on-site care coordinator. There may not be someone who is helping with Medicaid enrollment. But again, it's a pediatrician that's really specializing in care for that child. They can absolutely refer for any additional specialty care that might be needed, like pediatric neurology or any other specialty care that might be needed. And again, there's that benefit of concentrating specifically on children. When you're thinking about a pediatric private practice, it's also really important to confirm that they accept someone's insurance. So if they accept Medicaid, also if they accept that person's MCO or Medicaid Managed Care Organization. And we are going to talk a little bit more, actually a lot more, about navigating Medicaid and managed care organizations a little bit later in today's session. So then there's also the large health systems and the academic medical centers. So these really are able to provide care for the entire family because there's pediatrics as well as adult medicine clinics, within these large health systems. If someone needs referrals for any kind of specialty care, then referrals are often made kind of within that same system. So sometimes when there's challenges when a referral is being made, from one system to another, record transfer can sometimes be a challenge. So the nice thing about academic medical centers and large health systems is that those referrals are usually made within the same system and there's no difficulties with record transfers. There's also multiple specialties often available. Again, it's always really key to ensure, what they accept as far as Medicaid and insurance status. If folks are uninsured, then every large hospital is going to have a charity care program. That process is going to look different in each system. There's not like one process that applies to every single hospital. So it's really important to know that every hospital is going to have a different system, and it's going to you'll be talking to different offices. It might be named something slightly different. For Cook County Health, there's also the CareLink program. And so that information is in the deck as well as resources for you. But again, all of the large hospital systems will have a charity care program. And then there's the federally qualified health centers or community health centers. Again, these are typically care for the entire family. They often have a care coordinator on site. They can help with Medicaid enrollment, particularly the federally qualified health centers have benefits enrollment specialists on site. Again, many provide referrals for community-based services as well, and they refer out for specialty care as needed. They are going to be accepting Medicaid, and for uninsured folks, there's usually like a sliding fee scale, and so you can check with that health center of what that sliding fee scale is. If anyone needs help finding an FQHC, there's a link in the deck and in the resource packet so that you can have that resource to look up and find an FQHC and support families who want to pick that. So now we're going to talk and focus specifically a bit on resources for children with disabilities. So early intervention services. Is anyone in our group familiar with early intervention services? Or feel free to drop in the chat if you are. the key things to highlight about early intervention services are really just that this is a really critical time in childhood development. So early intervention services are for children from 0 to 3 who have developmental delay or developmental disability. To get that referral, they can be referred from a pediatrician, or you can self-refer. And the numbers on our screen here and in the deck are to, again, get connected to a local early intervention office. For Head Start and early Head Start, that's from 0 to 5. For any families with low income, there's the referral information on your screen. And then also recently, we have that expansion in Chicago for Preschool for All. And there's information on your screen for how to get connected to that. I think the main takeaway really when we're thinking about early intervention services is that early intervention is key. So the earlier a child gets connected to services and supports, for them and their family, the better. These developmental milestones and getting supports around developmental milestones when needed, it really is critical, for lifelong success and thriving. So that child has the life that they want to have, and has access to resources to achieve all their goals and to continue with their development. So there's also resources we really wanted to highlight when it comes to advocacy and family support. So the Family Resource Center for Disabilities, this is available for the Chicagoland area, so Cook County and all of the collar counties is kind of their region. It is a parent training center, and they have really excellent resources, particularly for navigating the school system when we're talking about IEPs, and we're going to talk about what that means in just a moment, or services in schools for children with disabilities. They have excellent advocacy, information, training, and resources. There's also the ARC of Illinois. Again, this is a statewide organization, and they really specialize in providing resources and information on navigating systems and accessing services or supports for families. And then there's Equip for Equality. They really specialize in, again, advocacy and in really advancing civil rights for people with disabilities. So they provide legal services, they do a lot of public policy work, they do self-advocacy and really monitoring and then training and supports as well. An additional resource that this one is Chicago specific, but it's the Resource Center for Autism and Developmental Delays. This is another really excellent resource for families. They will work one-on-one with a family and a child to identify potential resources. They will assist with providing opportunities to experiment with different developmental toys and developmental supports. They will assist with creating social stories, which are really great learning tools. And they can assist with finding service providers and additional resources. So there's 2 different locations. Definitely reach out to them for any questions about their services or to find out more. So then when we're talking about individualized education programs, that's that IEP. So this is for children aged 3 to 21 who have an identified disability that impedes learning, so that the child really needs that specialized instruction to close any achievement gap. So the IEP is that plan for special education instruction. So it includes what supports might be needed, what services might be needed, and that really drives what services are going to be provided and ensuring what students with disabilities are legally entitled to receive. That IEP is developed really as a team, ideally. So the school staff, the students, their parents and guardians are all working together to really identify and talk about what's in that IEP. And again, some of the advocacy groups that we mentioned before can also provide advocacy as needed if there's anyone who's having challenges with an IEP or struggling in navigating that system. So really the content of the IEP, again, is really focused in on what that individual student needs, including recognizing where they're at with age, developmental supports, and ensuring that they're in compliance with federal and state laws. So when we're also thinking about school, there's a 504 plan. This is specifically for students with a disability, but students that don't qualify for special education services under the IDEA. So there's information about the Chicago Public Schools. There's a link there so that anyone can go there for more information and resources. And again, for any families that need additional advocacy or support when it comes to that IEP or a 504 plan, that Family Resource Center for Disabilities is an excellent resource. And that's the group that we just talked about a couple of slides ago. So absolutely connect for those supports when needed. So at this point, any questions about services or support specifically when we're thinking about children with disabilities? We'll take a quick pause. Okay. And I would say, like, the other thing to consider, with COVID and remote learning, really there's there's been so many challenges for so many students. Absolutely don't hesitate to encourage families to reach out for that advocacy and support to ensure that their child is getting the support that they need in school and with their education. So there's some really great, excellent, advocacy resources out there. So when we're thinking about supporting families when they're getting care, would love to see if you want to drop in the chat. What are some challenges you've seen or you've supported families in navigating through when it comes to getting access to healthcare and access to pediatric care? Are there any challenges that you've had to see or navigate? And feel free to just drop those in the chat. Thank you. Yes, so definitely issues with accessing quality healthcare, absolutely. And then advocating to ensure access to quality healthcare. Absolutely challenges around getting enough time. Yep. I think that is very common in our healthcare system now, right? It's absolutely a challenge. Great. Well, thank you for those examples. That's really helpful. And if anyone else has other examples they want to share, absolutely, please drop those in the chat. So we wanted to spend a little time talking about how to support families in actually connecting to primary care, and in particular, helping a family identify what their priorities are.
Julia, we have a comment in the chat from Lisa. Can I speak my comment briefly?
Sure. Thanks, Lisa.
It was just a lot to type in. So I was working with a client who has county care, and she was trying to find a pediatrician, 3-year-old child and a 1-year-old child. And every time it listed, quote unquote, pediatrician, we went through that channel 3 to 4 times because one pediatrician didn't take anybody 7 or younger. So when you look on county care, it wasn't specific on what age. It just said pediatrician. So that was going to challenge. We make an appointment, and then we call the medical clinic. Oh, even though you were given Dr. Jones doesn't take anybody 7. So they need to be, I think the challenge is being more specific in that county care. So when they list that male or female doctor, they're specific at what age that doctor might treat. That's all I wanted to say.
Yeah, that's a great example of, there's only so much information that might be available on a website, and then the nuance that's not there means, I'm hearing you had to take 2 to 3 more steps and reach out to 2 to 3 more pediatricians to find one that actually was going to be a good fit and able to see the child. So that's a great example. Absolutely. So when we're thinking about connecting to primary care, and what Lisa just shared is a great example of finding a pediatrician that also sees that particular age, for example, as a challenge. And when you're talking with a family, so it's also exploring, do they have a pediatrician or a family medicine provider right now? Is there anyone that they're already connected to that they're have that relationship with, that we want to support so that folks can maintain that relationship? Because again, when for any of us, when we find a healthcare team and a healthcare provider that really works well for us, that we really like, then it's so important to be able to maintain that continuity. Other really important questions are, do they need to see, do they need to go to a clinic where the whole entire family can be seen? Maybe there's a family with 4 kids, wide range of ages. Does every age need to be able to be seen? Or maybe does one child in the household have a disability and really needs access to kind of more of that specialty care and services? Are there issues with location and appointment availability? What really is going to work for the family? Is there a work schedule that means, the clinic they used to go to just isn't going to work with the family's current schedule? Is there a health system that they, again, have been engaged with, that they really like, that they want to keep using? And thinking about what setting they prefer. So again, that healthcare system, the private practice, or the community health center. Thinking about which setting is really the right one for that particular family. And then absolutely asking those questions about health insurance. If they don't have health insurance, helping folks get connected to Medicaid, and understanding what their options are, as well as the added piece of understanding, what's in network versus what is not in network when it comes to insurance status. All right. So when we're talking about insurance, folks are likely going to fall, all of us are falling into kind of one of these buckets. So I might be uninsured. I might have Medicaid. There's a number of different programs within Medicaid that we're going to talk through. Then I might have employer-based insurance, or I might have insurance that I purchased through the Affordable Care Marketplace. And the links to those marketplace resources are in the deck for you. But again, most folks are going to fall into one of these 4 buckets, and we're really today going to focus most on Medicaid. So quickly, when we're thinking about families that are uninsured, it's incredibly important to make sure that the family is connected to Medicaid. The children can oftentimes get connected to Medicaid, and all kids, even if the parent cannot. And we're going to talk more about that. So that's really kind of like the first thing. If the children aren't covered, making sure that the children get that access to coverage. If folks aren't able to get insurance, so things to consider are Cook County Health. Cook County Health has that financial assistance through CareLink. There's federally qualified health centers that have the sliding scale fees. There's also in Chicago, so this is a Chicago-specific resource, a community clinic that's adults only called Community Health. There's also a program that was recently started through the Chicago Department of Public Health that's called Family Connects Chicago. It's the initial rollout isn't across the entire city, but its initial rollout is with a number of hospital partners, and it includes home visits for a follow-up after a child's birth. So home visits are scheduled about 3 weeks after the child is born. There's referrals available, again, depending on what might be needed or any challenges that are going on. And it includes a nurse, so a registered nurse, again, who has a ton of expertise and training who's providing these home visits, so that they're really just coming to connect in, see how things are going, see if there's any referrals that might be needed or supports. And there's no cost to anyone who's getting this service. So we wanted to make sure to highlight this for everyone as well. And this is a relatively new program that was rolled out in Chicago. So when we come to Medicaid programs, we're going to talk about moms and babies, all kids, and family care. Moms and babies is specifically for prenatal care. And then all kids and family care also include like that preventive care, primary care. So all those checkups, vaccines, school physicals, developmental assessments to assess, where a child is at with those developmental milestones, dental and vision, or any specialty care. Transportation can also be included through Medicaid, as well as then testing or lab work. So to talk specifically about all kids, and yes, the slides and resources will absolutely be sent out afterwards for the question in the chat. So for all kids, again, this is specifically for children. It's comprehensive and affordable health insurance, through Medicaid. Requirements are that the children live in Illinois, they're 18 or younger. There are some insurance requirements that we linked to that are more about, what insurance the family either recently had. One could actually still qualify for all kids if the premiums for an existing insurance coverage, are over a certain like percent of the household's income, things like that. So it gets the little nuance that we're not going to get into the weeds on. But again, children that are uninsured, all kids is an excellent resource. The custodial parent or guardian needs to be the one to apply for all kids. So here's the income eligibility for all kids. Again, this is for anyone who's maybe worked more with individuals navigating the healthcare system. It's kind of like one threshold for a single individual. But again, when we're thinking about families and all kids, there's actually a range of options available. So there's different kinds of supports at different levels, depending on the household income. So we have that shared with you. It's important to recognize that this income eligibility information can change each year. This is what it is for this year, but this gives you a sense again of what the income eligibility criteria are for all kids. And again, it increases with family size, or it changes, with family size. Again, there's also kind of different tiers when it comes to cost. So as you saw, there were these different tiers depending on income eligibility. So for example, for all kids assist, then there's also a different cost. There's no premium with all kids assist. If we're looking at all kids premium level 2, then there's a $40 premium per child. Again, I think for most folks, for most of the case managers on this call, we're really going to be looking at all kids assist. So again, there's no monthly premium. There's no, maximum monthly premiums for the households. And then there's no copays. So for the Moms and Babies program in Illinois, this really is actually called Medicaid Presumptive Eligibility. So it offers that immediate and temporary coverage for folks who are pregnant. They can apply through the clinic. It does have to be a Medicaid Presumptive Eligibility provider. So this would really be most, federally qualified health centers and community health clinics, the larger health systems. Again, they can process this application for this presumptive eligibility. And then the pregnant person needs to also immediately apply and follow and complete the process for the Moms and Babies program to have complete coverage for pregnancy. Traditionally, this has been structured so that it only covered care for 60 days after birth. However, in April, Illinois has a new, it's called a Medicaid waiver. Basically, it's a new program that increases that coverage after birth up to 1 year. So now, as of right now, because this actually started a little while ago, and this is in effect through the end of December in 2025. So it's kind of a temporary waiver. That coverage is now in effect for a full year after birth. So again, this is really recognizing that with the rampant health disparities and disparities in outcomes, that ensuring this critical continuity of care during the first year after that child's birth, so that the parent has that coverage, is really, really critical. So wanted to make sure everybody knows of that change. Again, something to really highlight, there is absolutely, no social security number, no citizenship requirement or documentation status. None of that is required for moms and babies. So again, someone's documentation status is not an issue when it comes to eligibility for the Moms and Babies program. You can see here's the income eligibility for family size. And once again, this information can change year to year. So this is what it is for 2021. So then when it comes to family care, again, this is care for the entire family. So remember, thinking back, all kids, just the children, moms and babies, the pregnant individual and baby, and then family care is for the household. So family care includes that coverage for parents living with their children age 18 and younger. It can also cover relatives who are caring for those children. Again, you do need to live in Illinois, and there are some income limits that will show in the next screen. Someone does need to be a U.S. citizen or legal permanent resident for 5 years, over 5 years. And then again, as with the other programs, here's that income eligibility piece that also can change each year. With family care, there are some cost sharing pieces. So there's no premiums. There is that $390 copay, as well as copays for prescriptions or emergency room use in non-emergencies. So that is the information for 2021. So that was, I know, a high-level overview of kind of the three main types of Medicaid that families might be using. Also wanted to actually just quickly highlight, we won't spend a lot of time on this, but hopefully everyone heard that in Illinois, the legislature passed so that Illinois is now providing coverage and health benefits for seniors over age 65 for immigrant seniors, regardless of documentation status. So that's another really important piece about Medicaid when we're thinking about the whole family or the whole household. That's another really important new change from this last year that's really important to be aware of. So applying for Medicaid. Anyone on the call or in our webinar, have you guys applied for Medicaid with folks before or anytime in the last couple of years? Would love to see if anyone has experience with that. Excellent, thank you, Shannon. So a strong yes. And that's good, right? Because that's a really critical and foundational piece, is making sure that the family is connected. And anyone have any experience they want to share about applying for Medicaid or that application process? Okay. Well, we're going to walk through the basics of applying for Medicaid. And probably the easiest access at this point, particularly with the pandemic, as we know, many DHS offices were closed. They are now kind of reopening But again, using that ABE website, so the application benefits and eligibility website, is really the ideal path to applying for Medicaid. So when you're using ABE, we'll shorthand it, but when you're using that application benefits and eligibility website, it's really important to make sure to record that tracking number and where the application is being sent. You can also apply for SNAP, cash assistance, and the Medicare Savings Program, all from the ABE website. Folks can also apply with an All Kids application agent. So these are staff that are often in community health centers and FQHCs that have staff that really specialize in doing Medicaid applications. This deck has a link to where you can find an application agent. They're throughout the state. And so again, those are folks that can ensure and support a family in getting connected to Medicaid and All Kids. Again, there's also that in-person option if you need it, and actually the office locator can be really useful for other resources as well. So it's the statewide DHS office locator. That link is in this deck as well. So you can do a search by county. If you're doing a search in Cook County, then it'll also allow you to pick a city or town from there to again find that that closest office. So we're going to talk more about using ABE. Again, in general, ABE would be kind of the resource I'd recommend the most because it's online. Again, you don't need to be going to offices. You can support a family in completing this online application, and then it can be tracked. If you also, so as a part of ABE, there's also a Manage My Case portal. So even if I didn't apply online through ABE, the same website has a portal for anybody who's a Medicaid member. So that Manage My Case portal is actually really important to be aware of and potentially utilize. You can absolutely, once you have Medicaid, set up that online account through that same website. Again, you can either apply through ABE or you can manage your case through that ABE website. There are a few challenges with setting up the Manage My Case portal. It does require identity verification. As we know, this can really often be a big challenge depending on my housing instability. If I've had a lot of different addresses, you know, having that proof of identity and the identity checking process can be challenging to navigate. Again, with any kind of like housing instability, address changes, all those components. So we'll talk a little bit about what to do when someone is not able to use the website and the kind of the algorithms in the website to verify their identity. There is an alternate process. But as long as I can navigate that identity verification piece, that allows you to then set up the account. And the identity verification is very similar to identity verification when like I might be opening up a new bank account or running my credit report. It's those same kind of identity verification questions that will be asked to verify that, yes, I am indeed me. So again, if someone's not able to navigate that, we're going to talk through that alternate process. But once you're able to do that identity verification and the account is all set up, that allows a few really important things. So one, checking the status of an application. It allows folks to have access to any notices that the state might have sent out. In particular, we want to be able to report any changes. So if someone had an address change or a phone number change, it's incredibly, incredibly important to update that. You can update that easily in the Manage My Case portal. The portal also allows folks to complete the redetermination process. We're going to talk about that more later, but redetermination really is that annual process to verify someone's continued eligibility in Medicaid. One can also upload supporting documents, like income verification, for example, as needed in that portal. And someone can also manage appeals and file appeals, like all through that Manage My Case portal. So to kind of begin accessing this, you're going to go to that website. You'll click on the Manage My Case button, and you're going to enter that user ID or create one to register for the first time. If this is someone's first time logging in, that's where they're going to need to link their account. So they created an ABE account, but now they need to actually link their Medicaid account. So that's where they're going to need to enter their date of birth and social security number, and that's what allows it that ABE account to link to their actual Medicaid case information. So let's say, I am not able to use that electronic identity verification. I might have lived 3 or 4 places in the last 2-3 years, maybe even in the last year. And with all those addresses and knowing when I lived where and being able to verify all of that in the way that that electronic system needs me to verify it exactly, it's just not going to work for me. So there is a manual identity verification process. So you can, again, you'll get this deck. You can use that link to print out a form. You need to sign, fill it out, and return it to the state. It does have to be returned by mail only. And this is what it includes. So a lot of times, just how when we're going to get, a state ID, it's the same kind of documentation that needs to be submitted to the state to prove that identity. So it needs to be copies of one item from column A or 2 items from column B. So again, copies of a state ID, a school ID card, passports, any of the, acceptable forms of identification, a copy of that. So again, if someone doesn't have ID, they're going to need to start, like any ID, they're going to need to start with getting that ID, and then they can complete this process. So Medicaid can definitely be challenging. I think, at least in my experience, there's a lot that those of us, when we're case managers, that we can support and help with. You're probably also going to run into occasional situations that just fall outside your expertise, right? That happens to all of us in every situation. So we really wanted to provide some additional resources so that when there's some situation that comes up that's just outside your expertise, a situation maybe you're not familiar with, or someone's just having a challenge and there's a nuance to the situation that's just really challenging and difficult, there are resources out there to get help or advocacy for families and to really be able to connect them. So there is the DHS helpline. I'd say this is a great resource, especially for address and contact info changes. And also, again, depending on where the family is going for their care. So if they're, seeing the pediatrician at the FQHC or a community health clinic, asking questions and getting help from one of those application agents is absolutely okay. Like asking them for their guidance to see if they can assist with the situation. In particular, the Illinois Coalition for Immigrant and Refugee Rights, they have a part of their website, and they have resources and expertise available specifically for any benefits information related to immigration, or depending on my immigration status, how that then relates to my access to benefits. They're a great resource, a lot of knowledge and expertise, so that's a really good place to connect for any questions there. And then last but definitely not least, there's Help Hub. That is a website. A number of organizations contribute information to that and kind of help manage it. But you can create an account there and it's really an excellent place to post questions. So you can actually post questions to that website. Experts will answer. Folks that are incredibly, incredibly knowledgeable about Medicaid and benefits, who have a wealth of expertise. I just can't say enough good things about, really the knowledge and skills of the folks that are answering questions in Help Hub. That actually, there's folks there who are my go-to questions or go-to folks for when I have questions about nuance that I'm just like, oh, I'm not quite sure what to do about this situation. So Help Hub is really, really wonderful. So we made it through. I've now got Medicaid. What's next? So when you're working with families, we can't stress enough that it's so important to make sure that that address is updated with both DHS and the managed care organization. So there's some really important things to know. Just because you update your address with the managed care organization does not mean that it's been updated with DHS. So both need to happen. The other important reason is that, with the redetermination process, due to the public health emergency of the COVID-19 pandemic, redetermination has not been dropping people from Medicaid during this public health emergency. That's going to continue, like people will continue to not be dropped as long as the public health emergency is in place. When the public health emergency declaration is ended, this halt on dropping folks who didn't complete the redetermination process or haven't been approved through that redetermination, folks will start being dropped again from their benefits in Medicaid. So it's almost like there's this cliff that's coming. And we know for everyone that, we're working with who's in shelters and supportive housing, we all know how difficult it is to get mail and to have that mail from DHS keep up with whatever someone's current address is. So what's wonderful is that no one has been dropped from their Medicaid during this time, but please know that this kind of cliff is coming. So if there's been any kind of address or phone number change at any point, in the last year or even in the last 2 years, I cannot encourage everyone enough to just make sure and talk to the family and remind folks that that address really needs to be updated, because that time will come when redetermination kicks back in. And folks really need to be getting those letters, information about their SNAP benefits, all of those pieces. So to update an address, you can go to the DHS hotline, do that by phone. You can go online. You can use that Manage My Case portal. But again, please make sure that we're all reminding folks that this is going to change and end, because we really don't want folks to, on top of all of the other challenges, then have this redetermination cliff that's coming up. So we're going to talk a little bit more about redetermination. So every year, Medicaid and the state verifies that someone is still eligible for Medicaid. Some of this is actually done electronically. So there are some redeterminations that are done completely electronically behind the scenes, kind of in this passive system where all of that can be verified with the state's systems, and folks don't need to actually even turn anything in. However, that doesn't work in every situation. So families need to be aware that they need to be on the lookout for this important paperwork. So that's why it's so critical to have those addresses up to date, or to use Manage My Case, because those notices will also be in the Manage My Case portal. If you have an account set up, when your redetermination comes up, there will be an automatically, there will be a button appearing that says like Renew My Case. That shows up 60 days before redetermination. If someone is dropped from Medicaid, within 90 days, they can be reinstated and get their coverage back if they go ahead and submit whatever income or other verification might have been missing. If it's been more than 90 days, then they'll actually need to reapply. Again, if there's requests for information that haven't been responded to, either by mail or in the Manage My Case portal, that will absolutely impact someone's Medicaid status. So it's, again, incredibly important to return this information. So it can be sent by email, it can be returned by mail, by fax. If one faxes it, I would want to make sure that it did show up. But again, it's incredibly important to respond to these pieces. So now we're going to talk a little bit about Medicaid managed care. And at this point, again, would love to see if anybody wants to drop in the chat any experiences you've had with the process of enrolling in an MCO, or even actually if somebody wants to share what is Medicaid managed care. Let's just start there. Would anyone want to drop in the chat what Medicaid managed care is? Okay, well, we'll dive into what that means. And one thing actually I wanted to make sure to highlight, so going back to your Medicaid applications too, I don't know that this is actually widely posted, but if someone is applying for Medicaid and if they have not gotten any kind of response, they haven't been approved or denied within 45 days, then folks absolutely can also ask for a temporary medical card and temporary coverage. So again, that 45-day mark is really important when it comes to a Medicaid application. If you haven't been approved or denied within that 45-day window, folks can ask for that temporary medical card so that they're getting access to coverage while the state is still reviewing their case. The state has actually shared, they're really actually done a lot to get caught up on backlogs. Historically, Illinois has had years where there have been incredibly long backlogs of applications, and the state actually has done a lot to catch up on that, which I heard at a meeting a while ago. So it's really fantastic to hear how they've really worked through that backlog. But again, it's important to know. So if you're at that 45-day mark when you've applied, haven't gotten any response, absolutely folks can ask for that temporary medical card. So coming back to Medicaid managed care and what that means. So most people in Illinois who have Medicaid will need to select a managed care organization. There are a few caveats to that. There are a few carve-outs where there are some folks who, because of other situations, don't have to pick an MCO. But just know that for the most part, by far the majority of folks who are enrolled in Medicaid are going to need to choose a managed care organization. So you can think of your MCO as kind of like a health insurance program. That's where the MCO actually works with the state of Illinois. But the MCO, the managed care organization, is actually reimbursing for each person's care, and they're providing care coordination. So that's the role of the managed care organization. When you're enrolling in Medicaid, you do, like once you're approved and enrolled, you do need to pick an MCO and also pick a primary care provider that's within that managed care organization's network. If I am enrolled in Medicaid, and if I don't pick an MCO, one will be assigned to me. The same thing when it comes to an MCO will also automatically assign a primary care provider if one isn't selected. So to ensure that someone's getting really that maximum coverage and benefits, it's important to just really make sure that you're going to in-network providers. So when you're seeing that pediatrician and getting connected to a pediatrician, and I think Lisa's example of the county care example, that is the right process. So going to your Medicaid managed care organization, either checking online or calling them, either one is fine, but to find that provider that's in network, or to verify that, oh, I see Dr. So-and-so, is Dr. So-and-so in network? So going out of network can really impact payment for services, coverage of medications, and really the out-of-pocket expenses. So you can change your MCO once a year when you're enrolled in Medicaid. That's going to be called your open enrollment period. When I'm in my MCO, I can change my primary care provider by just calling that MCO. So calling the company, and I can change that once a month. So changing my primary care provider is pretty easy and quick. Again, it will be effective for that next month usually. And I can make those changes. There's no limit to how many times I can change. However, just know that typically you can only change who your MCO is once a year. There is a process where someone can file a complaint with the state and request, to have a new open enrollment period. But I would, again, consider that kind of an exceptional circumstance. And Help Hub actually would be a great resource if there's something going on of that nature where somebody might need a little bit more advocacy of whatever might be happening with that situation. So again, with an MCO, there can be some copays for services and prescriptions. There are limits, the state defines what those copays can be, like it can't be more than whatever the state says. There are going to be some services and medications that can require prior authorization. So that's another piece where families might need some additional support or advocacy, particularly if there's a medication that requires prior authorization, or a referral to specialty care could also require that prior authorization. So that really means, talking to the provider, the pharmacy, and the MCO to really get that prior authorization approved. So a family really might need that support in contacting the MCO to do that advocacy, to make sure that that process is navigated successfully, or to prompt, if it's been pending, then making those calls to make sure that it's going through. Because usually those prior authorizations shouldn't take too long. And if it's, if you're not getting responses, if you're not able to pick it up, absolutely call that MCO and support families in navigating through whatever that challenge is with prior authorization. To have medication be covered by Medicaid, that prescriber does need to be in the Medicaid system. So that's another really important thing that changed, I think it's maybe 2 years ago or so. But again, the provider does need to be in the Medicaid. It's called the impact system for that Medicaid, or for that medication to be covered. So these are the MCOs that are available in Illinois. The one that I wanted to highlight in particular is youth care. So that one is specifically and only for youth and children in DCFS care. So the rest of the MCOs are statewide with the exception of county care. County care is available in Cook County only. This is a sample of what someone's MCO or health insurance card might look like. So the important things to look for, a lot of times there's key phone numbers on the back. The card will oftentimes have somebody's primary care provider, as well as their ID number, and which program they're in. So those are all kind of the key things to look for. So somebody's RIN number or ID number is really key, and you should be able to see it on their card. And yeah, Lisa, go ahead and ask a question.
Okay, so you have county care. It's just an example of somebody that I know that has county care. You get your mailing, your little county care envelope. You have your county care card that tells you where to go. You also have your paper card, as I call it, that you're able to cut off that gets in your paperwork. I know somebody that had county care and had 2 different situations, was sick in another town, and no urgent care would see that person. So they were told to go to the local ER. But yet when I called county care said that anybody can go, if they're in Illinois, they can go anywhere. They'll just be billed because their home address is in county care, if that makes any kind of sense.
So you're saying, I'm sorry, could you say again, like what your question
somebody
is?
I know, somebody I know was
Mhm.
sick and they have county care.
Mm-hmm.
They were not in Cook County when they were ill and or injured. We'll just say ill. So when they wanted to go to an urgent care, 2 urgent cares turned them away and said, go to a local ER. But when I called county care, they said that anybody with county care can go to another provider and they'll just do the billing through county care because that's where the person lives.
Mm-hmm.
So I don't know if I wanted to say that verbally because I know it's a lot, because like I said, a lot of my questions are too much to type. But I want to know if anybody can or if you can educate me or later or during the thing, because I realize county care is county care, but you know what I'm saying? I'm used to Medicaid being, you could use it anywhere. But now with that whole county care thing being somewhat new.
Yeah, and so just from the little I heard, that sounds actually like a provider issue. So that the urgent care provider, refused to see that person
Mhm.
because of the insurance that they had.
Okay.
Um, that provider likely also could have chosen to see that individual, and then they also would have had to work that out with county care as the payer. And from the provider's lens, they probably have rules about you know, what's not actually in network and if they will or won't see people in those situations, which certainly I am not equipped to speak to. But just from hearing that part, it definitely sounds like an issue where it's that particular provider,
Mhm.
and the urgent care clinics, who they will or won't see.
Right.
And
And
an,
then the
and an
person,
ER can't turn anybody away, which is probably why they referred them to the ER.
right, because with being a social worker, friends and family call
Hmm.
you for different things and so forth. I don't know if anybody else in the call has that, people looking for them for advice. And I was like, well, I called for you, but yeah, they're like, no, thanks for the help. But these 2 urgent cares, and wherever Northern Illinois University was, at DeKalb, whatever county that was, this happened to be in the DeKalb area, where NIU is. And so they ended up going to that local ER. But yeah, because they were also afraid of being billed
Hmm.
because they were out of Cook County.
Absolutely. I mean, I think, and that's a great example of the challenges of how our healthcare system is set up, you know, um, and how insurance is a driver of
Right, because you would
a
think
lot,
that
right?
people
So,
can't just stay in their home, in their home county. I'm sorry, I'm at the office. Um, that people, can't stay in their hometown. People get sick when they travel, grandparents, siblings, what have you. So
yep,
that's why I wanted to bring that up, because it was just kind of different for me. I was like, I thought I knew it, but you're always learning from this, from healthcare
absolutely,
information. Thank
absolutely,
you for letting me speak. I appreciate it.
no problem. Um, so, if you're seeing a family and they're not sure who they're like, they know they have Medicaid, but they have no idea who their MCO is. So let's talk through how to find that out. Make sure, if they do have any information that has their Medicaid or their RIN number, um, you can use that. But also, if someone really doesn't know, you can contact the Illinois Client Enrollment Broker line. So the phone number's on the screen, or there's also an online portal. This is the portal where someone actually picks their MCO. However, they can also support people in seeing who they're assigned to. So once you know which MCO the family is assigned to, um, the family can call, or absolutely case managers can call to support a family in making these connections. But to contact that MCO and ask if they have a care coordinator. If they do, make sure to get that name and direct contact information. If there isn't a care coordinator, families can absolutely request one, particularly for families experiencing homelessness. Families can absolutely request that care coordinator so that they have that additional support, access to resource, and access to that care coordination and advocacy, as they're navigating the healthcare system. And again, those care coordinators are great to reach out to, again, in a situation like Lisa just talked about. If there's barriers to care, questions, or challenges, care coordinators can hopefully assist with some of those pieces. Particularly when it comes from continuity between like a pediatrician visit and a specialty care visit. That's a really great example of of how a care coordinator can really be an asset. Again, if there's information or test results that need to be transferred from one system to another, those care coordinators can really assist and support with that. So when we're talking about care coordination, what even is care coordination? So again, this is through the managed care organization. Someone might have one assigned to them already. They can be requested. In particular, they're often for members who have complex needs or behavioral health needs. Care coordinators can also be embedded in the health center, so in a clinic, or sometimes the care coordinator is only available by phone. There can be a little bit of variety in how that's structured and set up, but just know both are options. If you're working with someone at a clinic or anywhere they're seeing their pediatrician, if the family has a care coordinator, it's important for the clinic to also know who that care coordinator is, so that again in the record and the whole care team is kind of aware of each other, right? So that there's good information and communication across a family's care team and the child's care team. How MCOs provide care coordination looks a little different by each one of the plans. But again, it's important to remember someone might be seeing a care coordinator in a clinic. They might also be meeting with a care coordinator by phone. There might also be some situation where a care coordinator would be actually going into the community and meeting at their home or a location of their choice. But again, the first step is to just like get in touch with that MCO that they're assigned to and get connected to a care coordinator. So things that you can really typically expect with care coordination is having a health risk assessment done. For the member, for the child, there will be a health risk assessment. The care coordinators develop care plans. So thinking about, again, for the child, are they up to date on vaccines? They'll be asking questions like that, making sure that if there's any specialty care referrals needed, going through all of those components of a care plan. The care coordinators also work to ensure that there's communication and information sharing between different providers on the healthcare team. So between the pediatrician, and maybe there's also a pediatric neurologist involved, for example. The care coordinator can support ensuring good communication between these different members of that child's healthcare team. Care coordinators are also really important when it comes to a discharge from the hospital. So if there's any follow-up care, any kind of care transition or referrals or extra support that's needed, with that hospital discharge, the care coordinator is absolutely there to assist and support any of those situations. So it's important to think about calling a care coordinator when there's questions about coverage, medications, tests, prior authorization issues, discharges from the hospital, or any additional questions or support around medical care, or getting access to primary care, like picking a primary care provider. Care coordinators can assist with all of those pieces. So when we're thinking about getting care, it's important to think about what is the right care at the right place. So we wanted to touch on the best time to connect with a pediatrician. That's for those well-child visits, school and sports physicals, vaccinations, any same-day sick visits, any kind of scheduled problem-focused visits. So child has allergies, and so getting in for an appointment, at the end of this week for that appointment to talk about my allergies or any other concerns, as well as those regular annual physicals. So for urgent care, typically that's going to be like a walk-in visit. It's going to be acute illnesses that are not life-threatening or minor injuries. We're going to be thinking about the emergency room for any kind of poisoning, major trauma, rapid breathing. If a child's been vomiting and no urination for several hours, that's an emergency room visit. Infants who appear limp, infants that can't be comforted, that are just really irritable, and there's no comforting them. And there's, of course, many other situations. If in doubt, you can also call the doctor's office, the pediatrician's office. Oftentimes they're like after hours, so you could even just call them, reach out, ask for their advice. Never hesitate to reach out to the pediatrician to ask for advice, get support, get assistance. There's not going to be a bad pediatrician call. It's okay to reach out to them and ask for that support. That is absolutely, why they're there. So when someone's going to a pediatrician visit, visits, and I think someone actually mentioned this earlier, visit length can be a challenge. So they're typically 15 to 20 visits. Also for children, it's important to think about vaccination schedules. So one, we know children and who's eligible for the COVID vaccine has been evolving this year. And so that's important to be aware of with families and talk about, but also vaccination schedules. So children may very well be behind in their vaccine schedules. So it's important and really critical to talk about that. There's also that yearly flu shot as well. Kids need to have school physicals at preschool, kindergarten, 6th grade, and 9th grade. With any high school sports, there's going to be that yearly school physical. And children should just be seen every year, even if it's not required for that school, just again for that annual checkup. A lot of clinics will have a patient portal. Transportation might be available through that MCO, so it's important to ask about. And then again, for families with more than one children or more than one child, it's important to ask about the maximum number of children that could be seen per visit. So, for example, can all 3 children be seen at once? Are there any special circumstances? Making sure to advocate for that family if between, where they're staying, work schedules, really advocating to explain why a family might need a special accommodation to make sure that all the children can be seen that day, or to just make the clinic aware and provide that advocacy and good communication, so that if there needs to be an exception made, that you're asking for that. Again, it's important to also be aware of virtual visits. Again, we know this last year with the pandemic, lots more virtual visits. So there could be questions that might actually be really well suited to a virtual visit. Again, we want to remind everyone about vaccinations and the importance of that, as well as recognizing trauma that's happening to children. So experiencing homelessness, the trauma of this last year with the pandemic, loss in the child's family, trauma related to the social justice uprisings and uprisings for racial justice, violence in a neighborhood. These are all really traumatic experiences for children. And so making sure to talk to a pediatrician if any additional supports might be needed and helpful. We also added a link to some CDPH supports. So the Chicago Department of Public Health actually has some COVID-specific resources that we wanted to share. So with that, we really wanted to, again, highlight that there are some basic keys to kind of navigating these health systems and how important it is, because I think we all know that our healthcare system is complicated. It is not always easy to navigate. In fact, it's probably harder to navigate is probably more the typical. So we really wanted to provide support to everyone as you're thinking about how you're supporting each family and making sure that every child has access to pediatric care so that they're getting the care and support that they need to ensure that children are healthy and able to thrive and do really well in life, because again, childhood is everything. So at this point, we wanted to do our post-test. So Shirlena, if you could bring up our post-test. So if everyone could take a couple more minutes to do this post-test, we really appreciate it. This helps us know about the impacts that this training had, so that we can also, report out and share information with funders about the effectiveness of this training. So we really appreciate everyone taking about 2 minutes if you could answer just these 4 questions on your screen. Oops, sorry. For this poll. Again, thank you to everybody who's filling out the poll. We're going to keep leaving it open for a little bit longer. But we absolutely appreciate you taking the time to do this poll and the post-test for us. All right, we'll leave this open for maybe another minute or two. And we absolutely appreciate everybody taking just a few moments to answer these 4 questions. And absolutely, if there's any other questions that came up, I appreciate everybody dropping into the chat as you had questions or coming off mute. Absolutely, please feel free to drop anything else in the chat as we're winding down our time together. So again, Charlene is also, thank you, Charlene, going to drop in the chat for us a link to the evaluation. It's really helpful to have your feedback on today's session on if, what was helpful, what could be improved. That's incredibly valuable to us, and I just really appreciate you taking the time to do that evaluation. Mary is also going to be sending it out by email along with the resources. And as she mentioned, ICAP is going to be posting this recorded session on their website. So that will be available, and all of the resources that were embedded in this will be available afterwards. So again, we're super appreciative for everybody taking that time in the post-test and doing that evaluation. So to just kind of wrap this up, I'm going to leave the poll open a little bit longer while we're wrapping up, but wanted to just highlight, so when we're thinking about implementing all of this into practice, because I know this is a lot to squeeze into 90 minutes, and I totally appreciate everybody hanging through. So again, just thinking about how we're supporting families and making sure that children are connected to that pediatric care, and how we're integrating all of this into, that day-to-day work when we're supporting families. So making sure that, families are finding that pediatrician, they're finding a pediatrician that's a good fit for them, identifying any of those health needs and really overcoming any barriers to getting appointments, accessing care, and navigating those Medicaid issues. So with that, we wanted to just close our session today. Again, I'm incredibly appreciative for everybody who joined us today. Thank you again for the evaluation that you'll be completing for us, and also for completing this post-test. We wanted to wrap it up by just a special acknowledgement for the Sprague Memorial Institute as a project funder for this. So again, you'll be getting all of the resources and information sent out by email. We appreciate you doing that evaluation. And yes, Mary, thank you for the prompt. So we can absolutely quickly go through the answers in the post-test. So quickly, sorry about that. So for the question number 1, the Moms and Babies program requires a Social Security number, citizenship, or documented status to qualify for coverage. Is that true or false? So that one is definitely false. So hopefully everyone leaves here being like, yep, no one needs to have documentation status. No one needs to be a citizen. None of that is required for the Moms and Babies program. When it comes to using the AIDS application website, so for Medicaid application and benefits eligibility website, people can apply for SNAP, cash assistance, or Medicare savings program. Absolutely, that is true. Before the COVID-19 public health emergency declaration, which of the following was true about Medicaid redetermination? So it's true. If more than 90 days after they've been dropped, they have to reapply. That is true. And then which of the following is false about Medicaid managed care? So the one that's false is going out of network will not impact payment for services or coverage for medication. So that's the one that's false. So thank you, everyone, and thank you, Mary, for the reminder to go through the answers. I appreciate that. Have a fantastic rest of your day. And again, we really appreciate you being here. Thanks, everyone.